Thank you for being on the webinar today. My name is Katie Robert. I'm a consultant with the Community Health Institute, JSI, out of New Hampshire. We are working with the Department of Health and Human Services Maternal and Child Health Program with support of MICV and ECS funding to implement this exciting new project, the Trauma-Informed Early Childhood Services Highly Qualified Consultant Pilot Project, which is being led by Dr. Cassie Yackley. Dr. Cassie Yackley has formerly been with the Partners for Change project, which was under the Dartmouth Trauma Intervention Research Center, and recently launched her brand new consulting company. And I'm going to go ahead and hand this over to Dr. Yackley to begin the presentation. And again, for anyone else who did not hear the announcements earlier, if you have questions during the presentation, please feel free to type it into the chat box at the bottom of your screen. And otherwise you will be on mute. Thank you very much, and welcome everybody. So Cassie?
Thank you, Katie. Thank you everyone so much for joining us today to talk about this new project. And I think, as Katie said, we're really excited about it, and we also recognize this is a new version of early childhood consultation in our state, and so as always, open to learning and feedback and input from folks. So I'm going to start by just talking about what our hopes are this morning for the webinar, so that you're oriented to what the purpose is exactly. So today our hope is to understand how we came to get to this place of launching the Trauma-Informed Early Childhood Services Highly Qualified Consultant Program and its foundation program, TIECS. We want to make sure that if you're interested in accessing, or that you're at least aware of the TIECS curriculum, online curriculum that's been developed by my colleague, Dr. Erin Barnett, and myself. And so I would like to make sure you're aware of that. We want you to appreciate what kind of referrals can be made to the program. So it is limited in scope and specific in intent. And so we want to make sure that everybody's on the same page in terms of what kind of referrals we may be useful with. There's a variety of activities that we're able to engage in, and I want to outline what those activities are and give some suggestions for what that may look like. And we want to outline any potential outcomes that people might expect by accessing the program. So the webinar is going to start with an overview of the project. Then we'll talk about the specific goals and objectives of the program. We'll talk about who the highly qualified consultant group is, again, what the potential activities are, and how to make a referral, and what to expect from being involved in the project. So to begin with, many folks have referred to the parent program, the Trauma-Informed Early Childhood Services Project, as the TIECS project. As one of the co-developers, I wasn't aware that that was the name of it until recently, but I appreciate now that makes an easy memory tool. So it's built upon the TIECS Train the Trainer program, and that was a full-day curriculum developed by myself and my colleague at Dartmouth that really takes an in-depth look at effective intervention with young traumatized children and their caregivers. And Katie, I know later we can provide additional information and there'll be links, but after we trained initially a pool of about, were there 50, Katie?
There were closer to 40.
Closer to 40 experienced early childhood providers in the Train the Trainer program, and they subsequently went out and trained about 663 different early childhood providers. And that has been used, as I mentioned before, to develop an online curriculum that folks can access. So what is the TIECS-HQC project in particular? This is for early childhood providers. We're talking about childcare, preschool, Head Start programs, home visiting, early supports and services, mental health, and I'm sure folks that we have not listed in that list there, and agencies. We want to provide an opportunity to provide specific expert consultation regarding young children. So we're referring to children 0 to 6 who we suspect or we anticipate or there is known exposure to trauma and are in our classrooms, homes, various early childhood settings and exhibiting behaviors that are challenging for caregivers. And in particular, we want to be able to share and work with folks around approaches that are trauma sensitive and to build trauma sensitive environments. It is short-term training and consultation. So it could be either training, technical assistance, or again, consultation. As Katie mentioned, we're very fortunate in our state that we've had the opportunity to develop the project. So at this point, it is grant funded and there are no costs to the recipient of services. I think, as we all know, as adult learners, new practices and new understandings are not a single incident occurrence. And so it would be fabulous if we could pen a 2-day training or a 1-day training or a webinar and have mastered content. But typically, as everyone knows, it requires learning over time. And I think one of the greatest values I've learned is collaboration with other folks doing the work and the expertise we can glean and the ideas that we're able to share amongst that group. So the TIECS-HQC project is building on that advanced training. Many of our consultants were also TIECS trainers or have participated in the online training portion. We met as a group and did a day-long training in this form of consultation, and we will continue to meet for a full year as a learning community, and we'll be collaborating with each other on a monthly basis regarding the referrals that we receive through the program. One opportunity is that they'll be able to draw on the resource. I have been hired to provide those resources and make sure that we have at their fingertips and at referees' fingertips the kind of resources that they'll need to do the work around consultation for early childhood referrals. We come from a diverse group, and what I mean by that is we come from a variety of different backgrounds: occupational therapy, psychologists, mental health, educators. We began to add up the numbers that we all had provided and felt like we all felt old at that point. So we would share with this group and folks that we have an average of 25 plus years of experience in working with young children as a group. And as I mentioned before, it's a broad range of professionals. I'll mention those names later on. So here are experienced early childhood providers, supervisors, and administrators. So our consultants include myself, Cassie Yackley. I'm a licensed psychologist and have worked with young children for about 25 years. Susan Peterson with Riverstone Educational Consultants in Bedford. Cassie Ifranti with Northern Human Services in Berlin. Charlene Shields, consultant from Rochester. Beth Ann Breyer, a consultant out of Gorham. Sandy Hogan, a consultant from Nashua. Mary LaValle, a highly qualified consultant from Keene. Peg Mayhew, a consultant from Ware. Paul Bousquet, a consultant from Gorham. And Jackie Sparts, a consultant from the North Country. So as you can see, it's really nice that we also got pretty broad representations in terms of geographical locations. So what are the kinds of activities that were available to provide? And you can ask specifically on the referral form, which we'll discuss later. So the very first piece we want to talk about is the implementation of some form of trauma screening. And I will just say, as someone lucky to work with lots of different professionals across our state, this is one of the trickiest pieces about trauma-informed care to implement. I know the New Hampshire Department of CCYF, through the Partners for Change project, implemented universal screening for trauma and have screened over 1,000 children at this point in time. So I do know that we have large state systems that are moving in that direction. The intent of the trauma screening implementation through the TIECS-HQC project is not broad-based implementation of screening programs at agencies, but really training staff in appropriate administration and interpretation of screening measures, consulting with them about what the meaning of those results and scores are. So it would be working with staff already embedded in those settings who do some other form of screening or assessment that are interested in making sure that they include in their assessments, evaluations, screening, something that addresses child trauma. And this could range from having trauma-sensitive conversations that begin to elicit that information or begin to help professionals or caregivers think about the impact that trauma or adverse experiences may have had on the youth's life, and all the way up to administering specific measures that ask about both exposure to previous trauma and then any symptoms that you might see in a young child. And that would be a child over 1 year of age if we're talking about symptoms. Very hard not to be able to see everybody's faces right now, because typically when we introduce the idea of trauma screening, there's a lively discussion and some interaction. So I'll make sure at the end that I leave some time for questions and discussion so that we can wrap back around to that if folks would like to talk about that more. The next major category of activities for the highly qualified consultant group would be referrals to community resources to meet the child's needs. Part of it might be just establishing collaboration across child-serving systems, child mental health, child educational, child care, etc. Some of it might be identifying potential trauma-specific interventions available in the community. I am part of another project called the Growing Healthy Families Project, which is our state's first learning community in child-parent psychotherapy. But we've had broad-based implementation of child-parent psychotherapy, which is a 0 to 6 model, evidence-based model of practice for young traumatized children and their caregivers that demonstrates outcomes in both caregiver mental health and trauma symptoms and young child trauma symptoms and behavioral difficulties. And it's designed to work with multi-generational trauma. So at this point, approximately 75 clinicians have been trained across the state. And part of our job as highly qualified consultants will be linking, when appropriate, youth to these trauma-specific interventions or assessment for appropriateness and involvement in these interventions within our community. Some of the consultation will be child-focused, so a child in the classroom, as I mentioned before, that is having some kind of difficulties emotionally or behaviorally, or is challenging to manage around other students or for the educator or home visitor or a caregiver. And so some, probably many of the consultations would be individually child-focused consultations, hopefully in a family context in terms of our conceptualization. It might involve or would involve observation in the a setting that the referral is coming from, so the home or the classroom, etc. Assessment of the identified trauma, so beginning, as we mentioned before, to look at potential trauma or adverse issues that may play a role in the child's life. It could involve coaching around classroom-based strategies that address trauma-related needs, so identifying potential triggers, responding to trauma triggers, introducing ideas like emotion regulation, which many folks do already, but really looking at what the body of knowledge and intervention strategy is around classroom intervention. And some of that might be modeling strategies in the classroom, or as I mentioned before, coaching opportunities for educators, home visitors, or caregivers, et cetera. And then some support and guidance moving forward, that idea that when I try new practices, it takes some time, and I need opportunities for guidance and support to make sure that the strategies that we're implementing have the intended outcomes. Another type of activity potentially would be a classroom consultation. So this would be observations of whole classrooms There have been some really nice measures that have been developed to help people think reflectively about the setup of classrooms and the ways that they can move toward becoming trauma sensitive. One example is the collaborative classroom assessment. So classroom consultation might be for those who are just really interested in developing whole classroom approaches and strategies that have trauma sensitivity and more so that really optimize or capitalize on what we know now about brain sciences in terms of setting up safe collaborative classrooms that we know engage learners and enhance brain receptivity to new information. Some of the consultations may be from the home visiting sector, so involving home visiting sessions and potentially the caregivers. It might be providing information about trauma and young children for parents and caregivers, or similarly to the classroom interventions that we would be offering. It might be developing some home-based strategies that help parents or caregivers to address the trauma-related issues that they see for their children, and linking the families to other supports and services in the community, not only trauma-specific services, but other resources to help and support the family. And then last but not least, the highly qualified consultants are also available to provide the TIECS training, which is typically a 4-hour or 3-hour half-day training. It can be done in multiple segments or in single segments. So it would be that core curriculum and TIECS training, or a host of advanced topics that we could collaborate about and decide that would be appropriate based on the needs of the particular referral source. So Katie, I just want to check in and make sure that there aren't any questions that have come up that I wasn't able to see.
I don't see any. If anybody, again, if anyone's having trouble finding the chat box, if you kind of hover your mouse around the bottom of your Zoom screen, you'll see a little bubble that says chat, and feel free to type your questions in there, and I will keep an eye out and let Cassie know if any come up.
Thank you, Katie. So making a referral to the TIECS project, the first thing I want to emphasize is that it's critical that people don't include any form of identifying information in any of the correspondence, the referral form or the email, subject line, body, etc. So if we want to identify a particular youth, we're requesting that you use initials for that name only, or no identifying information. It's fine that we know who the referral source is, obviously, but no child identification. An automated form has been developed by Katie, and that form, as you see from the very top link on your screen, the http://bit.ly New Hampshire TIECS, if you go to that website, or if you go to that link, it will pull up a form that you complete. And when that form is complete, it will be sent to me as the project lead, who will review those referrals and then work with our consultants to assign appropriate referrals in that way. I've also included, there's other ways to get to that link, just in case. You can go to my website at CassieYackley.com. There is a project tab for the Trauma-Informed Early Childhood Services Highly Qualified Consultant Project. If you link on that tab, you're also able to access the link for the referral. And then I've included my email just in case other things present a problem or people have specific questions. I can be reached at CassieYackley@gmail.com.
Cassie, if I might, we've also requested that the link be posted on several other statewide resource pages, and we'll share that information as it's made available.
Okay, and I'm glad you said that, Katie. The other thing I thought about while you were saying that, and I have specified this on the website page that makes the link. Obviously, this isn't a crisis intervention services. While we certainly understand that many of these circumstances with young traumatized little ones reach the crisis level. This is a consultation service and not an emergency-based service for mental health crisis. Those should still be managed by calling 911 or a mental health professional that you're working with. What to expect from a TIECS-HQC referral or your involvement. First off, what we want to say is any inquiry is a valid inquiry. We're really looking to shape a model program for early childhood trauma-informed consultation. And so we're learning from you all and from providers across our state what those inquiries look like and what the need is out there. I will say that the whole project kicked off with a community needs assessment, which I'm sure many of you, thank you, responded to, trying to get a sense of what's really out there and is there a need for this type of specified service, which folks responded resoundingly yes. All services are confidential, and just like any other type of sharing of private health information, we cannot, and any agency referring to us will not be able to share any information about a youth without a signed release of information from the legal guardian involved with that youth. Those requesting services, so whoever's making that referral, your agency or your site, is responsible for obtaining the appropriate release of information from the involved legal guardian. What we will provide is guidance, information, and strategies about the impact of trauma for a young child. What we are unable to provide through the project, we anticipate that involvement in the project would range from anywhere from a single incident training or classroom consultation to perhaps an 8-week process. But what we aren't able to provide through this pilot project is ongoing long-term consultation and supports around a particular youth or classroom. We're not providing psychotherapy, counseling, or mental health intervention through the service, despite the fact that some of our interventionists or highly qualified consultants are mental health providers. What we will be doing, as we mentioned before, is providing linkages with appropriate evidence-based early childhood treatments that are being implemented throughout the state through other work. Yes.
Cassie, we actually have a question from Nancy. Nancy, I'm going to try to unmute you if you want to go ahead and ask the question. Or I can read the question, and then if there's follow-up to the response. So Nancy asked, if the child is already involved in the foster system, for example, is this appropriate? Or would we just work with the family workers in that system? What about special ed students? Would we work within the special ed system first?
Great questions. Let me start with foster care. And given I just spent the last 3 years working with, as a consultant with DCY, I have 3 Partners for Change. Those youth are near and dear to my heart. And as we've looked at the early TIECS stuff, I will certainly say that foster care youth, given their amount of traumatic exposure, certainly are frequent referrals or high need kids for these type of services. Everyone knows we work way too much in silos, and I would hate to think that we would do any intervention that wouldn't collaborate or work with it within the current embedded team that is with that youth. So I think it depends on, and we would have to talk about who all is involved with that particular child and how it makes sense to proceed. But if it's a foster care youth, I most definitely think that could still be an appropriate referral to the project. We would just want to have, again, conversations, discussions with whomever those other providers are that are involved. In terms of students involved in special education, I think this is an adjunct to special education services. I would not want us to, not identify or not link and hook kids up with appropriate services. But as I envision it, I would think that a consultation could be a benefit to a special ed team or an educational team working with a young child as part of their plan and as perhaps a training or consultation as an adjunct to that. I'm going to pause and see if that resolved it or if there were questions that came from my response around that. Okay. So the last couple of things that we're really not designed to be providing is legal advice or representation. I think that's obvious, but just want to mention that we're unable to provide that. And this is not supervisory experiences. There are opportunities either within the licensure structure or within the liability structure for supervision of work with folks, but really a consultation service. So this is my last slide in the project, and I'm going to say a couple things about this, and I would like to open it up to comments, questions, input about the project from you all. So as I mentioned before, if you'd like to make a referral to the project, you can go to the HTTP link listed there. You can also go to my website and click on the link for the Trauma-Informed Early Childhood Project, or send me an email and I can return with the link. Katie, you mentioned there's 2 other locations. One is through the Children's Trust.
I made the request for it to be posted through the Children's Trust and the Spark portal. I have not heard back yet, but we'll let folks know.
Okay, great. So at that, folks, I feel like I've given you an outline of some of the details that we're looking at. As I mentioned before, I would encourage any comments or questions that folks have at this point.
I'm going to go ahead and try to unmute everybody. If we have some feedback issues, I will mute again and folks can just type their questions into chat. So
thank you, Katie.
Let's try. So everybody's line is open. If anyone would like to ask any questions or clarifications, feel free to do so.
Oh, no.
So I am able to see now lots of folks on the line there. Again, thank you so much for joining us.
So act free.
I'm going to go ahead and mute everybody. And then
my whole work with Impact Banana. We're trying to get
work. So, Katie, were there any chat questions that people had?
Nope.
Okay. Again, thank you all very much for your time. And if you have further questions or comments, don't hesitate to make a contact via the information we shared today. Have a great day.